Hey, good afternoon. Dr. Alan Christensen here with you. Welcome to another session of Office Hours Live. So good to connect with you. I'm with you guys on a couple of platforms. We are on Instagram, we're on Facebook, we're on YouTube Live. And yeah, this is Office Hours. So as always, I've got a couple of updates I want to share. Important stuff, a lot of questions I've heard recently, and I'll grab a few of your top questions that come in. So I'm just getting set up where I can see things better. There we go. And yeah, I'm seeing people come on. Love to hear where you're from, any top health concerns. And then if you've got detailed questions about health, thyroid function, those are the main ones that I can address well. So hormones, there we go. So hormones, thyroid health, metabolism, those are the real big things. And I'm seeing a lot of folks come on right now, again, with you guys on Instagram, Facebook, YouTube, and welcome, welcome. So I'm just keeping an eye on everyone coming in. So yeah, I'm back. Kieran and I were up at our summer home. We're soon to become snowbirds. Our youngest is finishing up high school in a few more months, not that many more weeks actually. And she and I will be back and forth between Arizona and Minnesota. So we just had a week to hang out in the big North Woods. We celebrated our 26th anniversary and 26 great years. And we'll be back up there soon. But I'll maintain a lot of these after I'm up again. And I'm also toying with the idea of doing something on Zoom. I did a big long series of webinars, and those were a lot of fun. It was great to connect with people face to face and get detailed questions and talk through things. And I'm thinking about kicking out something just like that again for Zoom. And I might do that like once a month and make it to where it's a limited number, and we come in and talk about some topics and we field questions and cover them in good depth. So yeah, stay tuned for more about that. Hope to have some details about that soon. But welcome, I'm seeing many come on. So one thing I wanted to address quickly was a fear about avoiding iodine. Many have talked about going on a low iodine diet and being helpful for them, reversing their thyroid disease. But I've heard some that were just concerned about, what if they got too little iodine? Could they get too little and have that be harmful for them? Uh, and that's been a valid concern. We always want to think through those things. One of the concerns that's come up has been if there's too little iodine for breast health or too little iodine to prevent against breast cancer. I'm seeing many jump on. Happy Monday to Joanne and many on Instagram. I'm seeing some greetings come in. So good to see you guys. So yeah, big question has been if I got too little iodine, will it be bad and raise my risk for breast cancer? There's been a popular idea that the breast tissue is a part of the body that needs really high amounts of iodine to keep itself healthy. And it came about from some studies showing that iodine could lower the symptoms of fibrocystic breast disease. And it was a valid thing. There were studies from the late 80s and early 90s, and they showed that women that had painful fibrocystic breast, about 68% saw a substantial pain reduction when they used high dose iodine. They used about 5,000 micrograms per day, which is a lot. So, but many of them did see that it helped their symptoms. And so some doctors saw those studies and thought, oh, that must be because they needed more iodine. And that went on to cause a lot of the ideas about megadose iodine. And then others looked at the fact that women in Japan have lower rates of breast cancer than women do in other parts of the world. And it's known and not debatable that Japanese women consume more iodine. And so many of them thought the iodine must have been protective for them, and they must have needed that to lower their risk for breast cancer. So all those things make sense, right? So let's dig a little bit deeper into that. Well, with iodine, we've got to think about things in ways that are not always intuitive. So your body pumps iodine into the thyroid. There's also a pump that can be active in breast tissue. It's the exact same pump. It's called the sodium iodide symporter. Now, we need it in the thyroid because the amount of iodine we need to build thyroid hormones is more than the amount of iodine that circulates in the bloodstream. In the breast tissue, the pump is normally not active, but it is a little bit active when women are lactating. And it's needed there because the iodine needed in breast milk is higher than the amount in the bloodstream. So that all fits. We now know, however, that the pump is more active in fibrocystic breast disease, even more active than it is in lactating breast tissue. And high-dose iodine shuts off the iodine pump, which is kind of weird, but it happens. So a high dose of iodine shuts off the thyroid from absorbing iodine. It also shuts off breast tissue from absorbing iodine for a little while. And that's why it may help with the pain of fibrocystic breast disease. But that pump, that iodine pump, it's even more active in breast cancer cells. I got a few images I'm going to share with you guys. I'm seeing more people come on. Hey, Marilyn, glad to have you here. Welcome back. So let me get another images up here. So here we go. Oh, I had that opening thing on there. Well, let me change my camera source real quick. This will just take a second. Okay. Video. Yep. There we go. Now I'm going to get that other image, and here it is. Okay, so this won't show up, I'm sorry, you guys, on Instagram, but it will show up on YouTube and Facebook. So this image is how active the iodine pump is in different kinds of situations. So normal breast tissue for women that are not lactating and don't have fibrocystic disease or breast cancer, it's quite low. That's this red area over here. In the case of fibrocystic breast disease, the pump is more active. And then we're also seeing heightened activity in the cases of different kinds of breast cancer. Now, what they've shown too is that there's an estrogenic effect of iodine. So iodine actually acts like extra estrogen, believe it or not. Here was a paper showing how breast cancer cells were stimulated by various things. The control cells had no stimulation, so it was low. And higher up were those exposed to iodine, and then those exposed to estrogen. And one study showed that iodine was not as strong as estrogen, but it was similar. And another paper on a different type of breast cancer cells showed that iodine was even more stimulating than estrogen was. So it can directly stimulate these cells to grow. And here is a paper looking at a group of women who had breast cancer and trying to see what was predictive of that. And they looked at their thyroid function, but also their iodine excretion. And it turned out that their thyroid function didn't predict the risk of breast cancer, but the strongest thing that did was how much iodine was coming out of their bodies. Those who had the lowest amount of iodine in their system had the lowest risk of breast cancer. And those that had the highest amount of iodine were the highest at risk for breast cancer. So it was a perfect linear correlation all the way through. So you could look at it and you could think maybe iodine would protect the breast cells against cancer, but we know it does not. It actually raises the risks. And within Japanese women who overall have lower risks, if you divide them up based upon their iodine status, those with the highest iodine intake have the highest risk for breast cancer. So yeah, there's strong data saying that extra iodine raises the risk for breast cancer. So when I hear the question, how do I have to worry about getting breast cancer because I avoid iodine? The answer is no. Not only do you not have to worry, but keeping your iodine intake at a reasonable low level is going to lower your risk of developing breast cancer. And a recent related study showed that overall death and risk of other cancers also can relate to iodine status. So yes, it's not healthy to be on the higher side for iodine. It is safe to avoid the extra. That was one big thing I wanted to share was that one. One other that I wanted to talk about was the idea of self neck exams. The neck check is the phrase that we use, the neck check. I'm curious, how many of you all do a neck check currently? I'd love your feedback from you on Instagram, on Facebook, on YouTube. I'm watching in all of these. And just say whether or not you do a neck check. And if you do any other self-exams or not, it's okay. But yeah, just whether you guys already do a neck check or not, if you know about this. So thyroid cancer is the most rapidly increasing type of cancer amongst women today. It's increasing at much faster rates than breast, ovarian, colorectal, lung cancer, all of those. So yeah, if you do a neck check, okay, I'm seeing some hands go up, some saying that they do. I'd love to see more feedback. If you do or you don't, it's okay either way. But let me know if you already do a neck check. I'm curious about that. So yeah, just give me a thumbs up, thumbs down, yes or no, if you do a neck check currently. But yeah, back to the discussion. So thyroid cancer, most rapidly increasing type of cancer among adult women today, vastly outpacing all other common types, the big ones we think about. And the majority of women who have it and are detected early, they find it themselves. So it is appropriate to have your doctor examine your thyroid. It is appropriate to get thyroid ultrasounds when you have thyroid disease and stay on schedule with those. But probably the most important part is your neck check. Okay, so I'm seeing a lot of mixed things, some yeses, some nos. So far, it looks like the nos are more common than the yeses. So more feedback, neck check, yes or no, if you already do them or not. What I'm seeing a lot of is never heard of the neck check. So that's cool. That's why I'm having this discussion with you guys right now, because you need to hear about the neck check. It's an easy thing. It's non-invasive. It's very simple, but yeah, really straightforward. So what I'm going to do is take a moment right now and show you all how to do your neck check. And I'm going to get into a rhythm of talking about this about the end or beginning of the month on a regular basis. So we'll do it together. We'll get in a habit of doing this on a regular basis. You want to do it once per month. Now, who should do a neck check? Well, anybody with a thyroid. It doesn't have to be someone who has thyroid disease or who knows they have nodules or problems like that. Really, anyone with a thyroid should be doing this. So here's some more common questions coming up, some good comments. Never heard of it. I've heard that a lot. No one's heard of the neck check before. This is the neck check. You're going to hear it now. You're going to learn it. And James is asking, do we do it or should a doctor do it? Well, James, I would encourage 3 steps for screening for thyroid cancer. This is probably the most important one, but they're all important. If you have thyroid disease, your doctor should also have you on a schedule of regular ultrasounds. If you don't, you wouldn't need regular thyroid ultrasounds. The other one would be physical exam. So as you get a regular checkup with your doctor, they should palpate and feel your thyroid themselves. So those are the 3 parts of screening for what's becoming the most rapidly increasing type of cancer, for thyroid cancer. But yeah, the cornerstone of this, the foundation of this, is the home neck check. Okay, so how to do this? Well, you only need 2 things to do it. You want a handheld mirror. This is my invisible handheld mirror. The handle's hidden inside my hand, and the rest of it's here, but you can't see it. So truth be told, I can see myself on video right now as I'm speaking to you guys to make sure that I'm, in frame. And I'll use that for these purposes. But you would use an actual mirror that's not invisible. That's a real handheld mirror. So that's one piece. The other piece would be a glass of water. All the equipment you need. Now, in terms of preparing for this, you wouldn't want to wear a turtleneck, okay? You got to be able to see your neck. I can't remember if these are snaps or buttons. Huh. Okay, they're buttons. Okay. Yeah, if they break, then then they were snaps. All right, so you want to be able to see your neck. And you're looking at, basically, trying to make this stuff show better, you got your collarbones and you've got your Adam's apple. So this is the area we're thinking about. There's also these muscles called the sternocleidomastoids. I'm trying to make mine show up better, but they're right along the sides. So these muscles and the collarbones and the Adam's apple, that's our territory we're looking at. So we're looking at right in here. And the simplest part of this is the first step. So you're taking your handheld mirror and you're looking at your neck and you're going to drink some water. Now there's 3 phases to this. You're going to take a drink looking straight on as you're watching your neck. You're going to turn to the left. And you're leaning back just a little bit. You're going to turn to the right. See, I'm positioning my mirror so I can see my neck as I'm turning in these various directions. So yeah, so 3 big gulps of water, straight on. And in that case, you got to veer your eyes a little bit to the side and look through the mirror, with the mirror. And then to the right, to the left. So 3 big gulps of water. Now you've looked at the neck, the area of the thyroid. and you're seeing if anything looks uneven, if there's any bumps that emerge. I'm seeing a lot of folks jump on right now. Hey, you guys, I'm talking about the neck check. Now, the recording to this event will be up on whichever platform you're viewing after it's done. Please go back to the beginning and see the portion about all of the neck checks. So you can do this regularly with us each month. So after the 3 drinks of water, the rationale there is that you're pushing these tissues out as you're swallowing. You're creating compression from the inside against your thyroid, and you're going to push it closer to the surface. So a lot of the soft tissues get moved to the side, and any lumps or bumps would be more obvious when they're showing up that way. And if I have one, we might be finding it here in real time on live TV, but it doesn't look like it. So after you're done looking and drinking, the next step then is palpation. You want to feel with your hand. And if you're using a mirror, that's not as critical right now because this is all about touch and texture. It's often easy to use 2 hands, and you can go starting in the middle and work your way down and out, and gradually go to the side, go up again, and you're feeling for irregularities. You can also use one hand if your dominant hand is better. And in that case, you start on the far side and work down. This is over against the sternocleidomastoid muscle. You'll start there. You'll work down to the collarbone, and you'll work your way back up again and gradually go over a little bit. You want each pass to overlap on the last one. So you can be hitting each area multiple times and work your way down again. Now, if you see anything weird when you're doing the swallowing portion, that's the stuff to really check out with palpation. That's the stuff to really feel for to see if anything is unusual. So you feel all these tissues. So what are you feeling for? What does your thyroid feel like? Well, this is interesting. You actually shouldn't feel your thyroid. If you've got a normal size, shape, and texture of your thyroid, there's not anything to feel. You won't feel anything apparent at all. If there are enlargements, nodules, lumps, or bumps, they're more apparent. You will feel skin, muscle, tissue, connective tissue. There are structures that you will normally feel there. And the question is, how do you know what's abnormal? Well, the first time or two, I've got to just admit, it's not always obvious. So if you're doing your first one, anything feels quite unusual, check with your doctor. Go get a checkup. Some people even do one of their first self-exams while they're doing a medical visit. So they know right on the spot what they should be expecting or what they shouldn't be expecting. In most cases, nothing feels too weird or too unusual. And in those cases, still stay on schedule with your other screens, but you're checking over time. And the phenomena here is that your sense of touch has a lot more memory than you would ever imagine. This is kind of an odd story, but no joke. There was a doctor that I trained with who was a urologist. So everyone he saw, he would check their prostate. That was just what he did. And in many cases, he wouldn't remember details about someone until he was checking their prostate. And then you're like, oh yeah, how's Jane and the kids? You remember all these things. But that it's true. Our sense of touch has a great deal of memory associated with it. So when you check your neck regularly, you know what it should feel like, and you get a real sense of what's normal for you. And if something becomes different, you pick that up right away if there's some change. And that's the most important part, not even just seeing if there's something unusual, it's if there's something different for you. If something has changed under your skin that's new, that's what you want to be aware of. And that's what you can pick up on really well with the neck check. So we did that together, and that took all of, 3 minutes, just a couple of minutes. It's very quick and easy. And that's probably the most important single screen for the most rapidly increasing kind of cancer. And we'll get in the habit of doing these most months. Okay, so I saw a few questions about this, just a few, and I'll address those. And there were some other questions that came in as well, and I'll start diving into a couple of them. So let's see. How do you do a valid neck check? Oh, great. Yep, I did cover that one. Here's one. I do have a nodule. How do I separate that out? Well, you can't, I should say you couldn't so much separate it out, but you would get a sense of generally what's normal and about how that might feel even with the nodule. There have been studies looking at how well doctors can feel nodules compared to how well ultrasounds can find nodules. And even the best examining doctors only find nodules a small percent of the time as compared to ultrasound studies. So even if you have a nodule, Marilyn, or I think it was Marilyn that said that, even if you have one, you may not feel it. Or Marilyn, it was Marilyn, yeah. Even if you have one, you may not feel it. It may not make things seem different to you on your neck check, but do it regularly. If your nodule changes radically, or a new one forms, or other structural changes occur within your thyroid, more often than not, you're the first to notice that. So this is the neck check. If you even use hashtag neck check, there's a fair amount that comes up. This is a valid, helpful tool. It's a good screen for thyroid cancer. And I've really been motivated to help make people more aware of this. So I'm writing a big article about more depth on how to do it. I'm going to do a video. My lovely wife will be the assistant for that, and we'll make some more detailed information about it. But I'm also going to get here on social media and share this with you guys on a regular basis. So most months, about the end of the month, we'll take a minute and do the neck check together. It might be during office hours, it might be a separate thing, but we'll make it a regular habit. So get your neck check done. Okay, so follow-up question. What is a regular ultrasound every 3 years, or question? Yeah, Agatha, good question. So what is a regular ultrasound? Well, if you haven't had one done ever, that's not regular yet. Once you've had them done, the frequency is really determined by how things look, and that's often up to the radiologist and or the reading physician. Sometimes they may want to recheck it 6 months out. Some cases, they want to do it even 3 months out. More often than not, if they see some abnormalities, they'll watch it once per year. Some doctors may say you're good to go for several years, and there's many times where that's entirely reasonable. So the time frame is a little bit up to the ordering physicians, but if you've never had one, it's a good time to start with one. Okay, so follow-up questions. So what if you have multiple nodules in a huge goiter? How do you tell if it's cancer if you do not want a biopsy? Pam, great question. So you can't tell if it's cancer without a biopsy. To answer that one real quickly. And in terms of multiple nodules in a huge goiter, like with Marilyn, it might feel different because of that, especially if it is a large goiter, probably would feel different. But the big thing, the neck check is not so much to diagnose any kind of a disease per se, it's to see if things have changed. So it's to see if there's been a big difference from what's normal for you. And if there are things that are radically abnormal for you, you'd want to be aware of that. Pam, if there's feedback you have about the biopsy, I'm happy to address that. There is an idea that if you have a biopsy, it might make the cancer leak. It might make it spread around throughout the system. That's a valid concern, but it has been studied and it just doesn't happen. In terms of the size of the needle used, and in terms of the opening left, and also in terms of the method and the rate of metastasis for thyroid cancer, you won't make things spread or grow because of a biopsy. If it's spread already, the biopsy wouldn't make it worse. And if it was not going to spread, a biopsy would not cause it to do so. So this is a case to where it's always good to know. And biopsies, they're not perfect. They're looking at a fraction of the thyroid, and they're inferring about the rest of it. And they're done trying to find the area that looks most suspicious, but sometimes they are indeterminate. That happens. But if you have thyroid cancer, you'd want to be aware of that. There are effective ways to treat it. And they do often involve, first and foremost, taking out that tissue, whether that's part or all of the thyroid. But yeah, thyroid cancer is entirely survivable in almost all cases if treated, but I'd encourage you to be aware of it. So please, if you're recommended to get a biopsy, I would encourage you to get a biopsy. How do you tell the difference from lymph nodes? Yeah, James, great question. As a generalization, lymph nodes can occur in places that you wouldn't expect, like not in the normal anatomical areas, but generally they're going to be further above this area in which we're working. So most commonly, cervical lymph nodes are just below the jawline or just behind the neck. We can also get them in the groin, the inguinal lymph nodes, or in the armpits. They are things that are not directly related to thyroid function. If thyroid cells become cancerous metastasize, they can spread there, but that's a very late phenomena. So lymph nodes can also come and go from infectious disease, acute illness. They can change. If someone does have large, uncomfortable lymph nodes that are growing, that's also worth being medically aware of. They can be significant. But as a generalization, they're going to be higher up and further along below the jawline, or along the back of the neck, and not so much in this field where we're studying to check out the thyroid function. I see a lot of other good questions, you guys. I'm going to grab a couple of these. I just want to see if there's others that relate to our current topic before I move on from that. So yeah, this is about the neck check. Each month, be there, be square, make it happen somehow. It's a helpful thing to do. I think I saw a couple that related to this on Instagram too. Okay. Here's one. If we have nodules, when is it necessary to do a biopsy? Can we just treat them with your thyroid nodule products? Yeah, Connie, great question. So there are ways to help nodules, and the nodule control is the main supplement for that purpose. When to do a biopsy? There's actually a lot of detailed discussions within thyroidology about when to biopsy and when to not biopsy. The best answer is really when you're suggested to have a biopsy. The guidelines are rather clear based upon how large the nodules are, how many they are, various characteristics of them, your TSH levels, things like that. So if you're suggested to have one, it's better to have one done and see if they are truly a concern or not. Another one, are there side effects of a nodule shrinking or getting smaller? Extra thyroid hormone symptoms, etc. It's a logical question. However, no, when they do shrink, they shrink quite gradually. And the other thing is that nodules are generally not active thyroid tissue. Generally, there's some that are called toxic nodules, and those are making too much thyroid hormone. But normally, nodules are not as metabolically active. So if you were to have one piece of your thyroid like shrink super fast and it was active tissue, you're right, that could dump a lot of hormone in your bloodstream. But nodules don't shrink super fast, and they're normally not very metabolically active. So no drawbacks to them shrinking. Hey, Macho Lava's with us. Hello, back to you. Hope you're well. Good to see you join us. You missed our neck check discussion. So, Macho Lava, are you doing your neck checks on a monthly basis? If not, your recommended reading is to come back at the end and check out the re-recording of the video because they're super important for you. Okay. So some good questions. Let me grab a couple of these here. Yeah, I just want to address this one. I take Cytomel 7-MCH. I'm guessing that's MCG, of course. So 7. So quick part about the question. This is on Instagram. The Cytomel 7, either you're on a compounded medication, which would not be Cytomel, or you're not taking 7 micrograms because Cytomel doesn't come in that potency, and compounded medication is not Cytomel. So I'm not clear about that part. And then Tyrosint Sol, the liquid solution, 125 micrograms. She's listing hormone levels. TSH is 4. Doctor increased tyrosine to try to lower TSH. Said other levels are okay. I'm 46. Female weight keeps creeping up. So I don't know if there was a question in this. Weight gain, thyroid levels, there's certainly a relationship there. And for those on medication, you can do better to have your scores lower. The proposed change is a reasonable change. A question, though, is how much do medications help with weight loss? So thyroid disease can cause weight gain, but the question is, do medications help with that weight loss? In most cases, they don't. I'm not saying you shouldn't be on them, and I'm not saying you shouldn't adjust the dosage, but I have seen to where there can be an expectation that if I just get these levels right, if the medicine is perfect, then weight returns to normal. And that's almost never true, sadly. Now, if your scores are off by a lot, weight loss is harder for sure. But it's rare that correcting the scores with medication alone automatically leads to weight loss. So please do know that. The other thought is whether or not starting medications will help weight loss. And that very clearly is no. There have been big papers on this. So even when thyroid disease causes weight gain, the medications don't tend to help with weight loss. So yeah, please, if you're not aware of this, please take a look at the metabolism reset diet. That approach can help with weight loss even while you're sorting things out with the medication. And even further along those lines, you may notice that your medication needs change because of the metabolism reset diet. If someone's there that has experienced that, please share for inspiration. But tons of people have done that program, lost weight, and needed less thyroid hormone because of it. So, and that's even when thyroid levels are not good going into it. So again, I completely honor getting your levels right. That's helpful. It usually doesn't lead to weight loss though. So it still takes other steps with that. And by far the best one that I've seen is what I put together was the metabolism reset diet. And you may need less medicine from that. So, yeah. Okay, so here's one that came in early along. This is from someone with us on YouTube. She asked not to show the comment on the screen. Of course, I'll respect that. TSH dropped from 3.6 to 1.25 after following the thyroid reset diet. Currently taking Synthroid 75 micrograms. Should my dose be lowered? So, yeah, great question. This is from Tamara. You have the option of lowering that for sure. You're not at a level to where you're getting a dangerously high dose, but you are at a level to where many doctors do consider deprescribing a reasonable option. So yes, that's a good change. That means you're moving in the right direction, and that's highly encouraging. Uh, if you wish to mention the dosage you're on and how that compares to approximate body weight, I can even give you some insight as to how much hormone you're making by yourself. But whenever your scores change like that, and you're not on a very high dose, so you likely have a good chance of needing less medication over time. So yeah, good thing. Here's one. Do you recommend any essential oil to add to castor oil packs? No real reason for that. Oh, and I see it. This is in response to my encouragement to start the metabolism reset diet. Just started the diet today. That's awesome. This is from Queen Bee on Instagram. Say, Queen Bee, if you didn't know this already, we've got a really great free Facebook group for the metabolism reset. Just metabolism reset diet. Put that into Facebook and you'll find it. We've got 20 some odd thousand alumni who are in the group. They're active. My team is there giving ongoing support. So you can get a ton of tactical and emotional support and guidance during that process. And it's a really good community. So if you're not there already, you may find that useful. Let me grab a couple more here. Several good ones here. Boy, I'm just picking and choosing, guys. I'm sorry for my pause, but I'm choosing between which question to get because there's a lot of good ones. Here's one that correlates what I was saying before. Let's see. Does being on thyroid medication lower the thyroid cancer risk if someone has subclinical hypothyroidism? With subclinical disease and the cancer risk, this is a little nuanced. If someone has existing cancer, an elevated TSH may cause the existing cancer to grow more quickly. If someone does not have thyroid cancer, subclinical hypothyroidism wouldn't make them develop thyroid cancer. So I'm not sure if that was a clear distinction. So treating with medication wouldn't make you not get cancer if you didn't have cancer. If you already did have cancer, lowering the TSH through any means might lower the rate of the cancer growing. And that could be lowering the TSH through dietary approach or through medications. So hopefully that was a clear distinction there. Let's see. Here's one from Paul. Let's see. Gave your approach best try. Hard to differentiate. My TSH went from 3 to 17 after believing reducing iodine to 0 for 90 days. And there was something else. Do check iodine. TSH 18 last January. Am I affected by cold Duluth, Minnesota weather? Hey, Paul, I know about cold weather. You got some more wind up there in Duluth, but we're in more north central Minnesota a bunch of the year. We were just up there. So the temperature does change levels, but not by enough to explain that. So some people do have big fluctuations that don't track with their longer term trends. And it looks like this was from November to March. So you just did those last tests and you were high before, it looks like. So this looks like a 4-month time frame. Check a few more times, see what your trend is. Paul, your options are watch again, see if this is a fluke or not, or do a test to see if you are still excreting a lot of iodine. And Paul, this is where the urinary iodine to creatinine ratio test is useful. I'm going to put a link up here so you can see that because I've talked about how to do that test. Find this real quick. How to do it and also how to read that accurately. Okay, so this link will be visible on Facebook and Instagram right now. Also, it's how to test your iodine levels. And You test like that, and if you're above that 100 micrograms of iodine per gram of creatinine, you need more time to get iodine out. There was just a lot in your system, or there's still some coming into your body. There were some hidden sources that were there. Now, the third scenario, if you're really low already, then watch 3 more months. If your thyroid is improving, call it good. If it's not, check again. If you're still low, that approach won't be helpful for you. You're probably in the 3% for whom that won't help. That is about 3%. So in most cases, we do see good improvements over time by regulating it. But yeah, Paul, you're exactly a candidate where you could consider testing to see if you need more time or if you're still excreting a bunch of iodine. Now, you can't tell those two things apart. That's more a matter of detective work and just thinking it through on your own end. If you did take some high dose iodine supplements before, maybe you had a lot of seaweed in your diet, you could well fall in that need more time category. On the other hand, if after thinking it through, you saw some cosmetics, or you're a guy, you look like you're not, not worrying about a lot of that kind of stuff, but who knows, body cream, face lotion, maybe there's some source you found that was missed, then it could be a matter of more coming in. But yeah, just check that out, and testing might be a consideration for you. You could also just do another TSH, see if it's like it was in another month, and take it from there. That would be the first thing that I would suggest, in all honesty, because for some people, they can bounce up and down in ways that don't always reflect trends. So here's a good one too, and this is a related one from what I was just talking about. If you had hyperthyroidism, could you take iodine? So if you had hyperthyroidism, so the question, Machalab, is why would you want to? Now, they've studied the use of iodine to treat existing hyperthyroidism. And I've talked about how iodine slows the thyroid, and it's no secret, and it's quite consistently effective. So there have been clinical trials in which they've checked to see if iodine could be used to treat hyperthyroidism. And it usually does work, but the problem is there may be a higher rate of thyroid storm from those using iodine. So at present, it's not recommended as a treatment for Graves' disease. Again, it's probably effective, it's often effective, but there may be safety issues. Okay, sorry, making sure. Yeah, if you do have hyperthyroidism, it probably could work, but it's probably not the safest approach. So to slow the thyroid, all the medications that slow the thyroid, they do so by lowering the intake of iodine into the thyroid. So the less iodine you have available for it, the better anything works. And there are medications that can work pretty well for that. There are natural options, but most of the natural options are still prescription strength. They're prescription strength versions of lithium and or fluoride. Those are both minerals to where you can get too much of them. Your body needs some of them, but the earliest sign of too much is a slowing down of thyroid function. And in the case of hyperthyroidism, that's a good thing. So, Majalava, I don't know if you're in a state that our doctors work with, Arizona, California, Washington, Oregon. There's a couple more. Utah's in the mix. Yep, I think that's about it. If you're in one of those states, you can work directly with our doctors. They can often use natural compounds like that. If not, you're much better off being treated with a medication like methimazole or propylthiouracil than you are to not be treated. But with that, using the thyroid reset diet, you can respond much more quickly and need much less medication. All right. You're welcome, Paul. I saw that. So Cindy, here's a good one. I'm seeing a lot of really good questions, you guys. Let me just get one or two more. I did a lot of talking today. Did a bunch of fun interviews I'll share with you guys when they come out, and I've got a bunch of talking tomorrow. So I do thyroid second opinion consults every so often, and I've got a couple of those going on right now. I think I've got a few more in the next month or so. Then I'm back up to Paul's country to northern Minnesota, and I will be not doing the consults, but still doing some live things over the course of the summer. So yeah, I've got to spare my voice somewhat. How about extra selenium for hyperthyroidism? Betty from. So for hyperthyroidism, the best thing I would encourage is hyperthyroid support. And that's the blend that I put together for the purpose of helping hyperthyroidism. its goal is to help people need less medication, have fewer complications from hyperthyroidism, and not have a lower risk of Graves' eye disease as well. I did include selenium in that, but there's other things that work well with that to synergize. So yeah, check out hyperthyroid support, and I'll make sure links are available for you all for that. You're welcome, Matcha Lava. Glad to help out. Here's from Vivian, wonderful name, my mom's name and my best friend's mom's name. TSH below 0.5 for a long is TSH below 0.5 for a long time correlated with osteoporosis. 0.5, Vivian. I don't know that for sure. I know for sure if you said 0.35, the answer would be yes. Many studies show 0.35. Many studies show 0.4. I don't know for certain if 0.5 is. I know that if you're over 65, it may be. But under 65, 0.5, I don't have that at the top of my head. But when we talk about splitting hairs that closely, TSH levels are never that precise. You can do the tests as accurately as possible, and there's always going to be a fudge factor of sometimes even a full point. So between 0.35 and 0.5, not really a meaningful difference. And I would guarantee that all of your labs aren't 0.5. So it's really your average over several readings that means the most, not a single reading, because you're not going to always be at that same single reading. As a generalization, if you're much lower, what happens is TSH carries a signal that tells new bone cells to grow. We call these the osteoblasts. And when TSH is too low, they don't grow. We need it. We need it for things other than just thyroid function. And too low is around where you are, definitely a little bit lower. But yeah, a good thing to track over periods of time. And you bring up an important point because the risk of bone thinning comes first from a low TSH, long before it comes from high levels of T3 and T4. The earliest thing is that low TSH, and that's the main thing that actually causes bone thinning because the bones need TSH in order to grow properly. They don't really grow without it. Okay. Maybe one more. Maybe I'll call it good. Let's see. I'm going to screen here again on Instagram. I think I got those pretty well. Oh, here's a quick one I'll get for our last question tonight. Oh, no, I'll get this one instead because this is one that I should cover for you guys. This is an important one to be on top of. Should I take my levothyroxine the day of my annual blood test? Well, you should take it, but you should not take it before your blood test. You should do your blood test first and then take your levothyroxine. I'm assuming your doctor didn't give you different directions. If so, defer to what they were hoping for. But if they're measuring your T4 levels especially, those scores will be goofy if you take your pill and then take your test. They're going to be high, but they won't know exactly how high they should be. So it's hard to read then. So yeah, you want to do your test before you take your pill in the morning. So still take your pill that day, but take it after your blood test. What I tell people is take it away from food all the time. If you have to eat after your blood test before you take your medicine or at the same time, not the end of the world that day, but just make it that day. So yeah, take it still, but after your blood test. The other important thoughts are you want to be fasting when your thyroid labs are done. You want at least a 3-day break between any supplements and your thyroid blood test. This is especially true for those that have biotin and probiotics. But yeah, 3 days off of supplements before your blood tests. Fasting, you want them done in the morning, not noon or afternoon. And like I said, before the medicine. And then also, if you're a menstruating woman, you want to get them the first week or the last week of your cycle, but not mid-cycle. That gives you goofy results. So yeah, good question about that. Okay. Good discussion this afternoon. Nice to see you guys. Everyone do your neck check today. If you've not done one recently, we'll get in a good habit with those. And if you came on later, check the replay. You'll learn all about how to do your neck check. And I'll see you guys again really soon. I plan to be back next week and we'll pick it up again from there. In the meantime, have a great evening and take care of yourself and your thyroid. Bye-bye. Let me find all my end buttons here.